Good morning, good afternoon, and good evening to everyone who is joining us today on 19th for our discussion with Dr. Che Martin from Cameroon. My name is Dr. Morris. I am a primary care physician, internal medicine physician here in the US, practicing in Tucson, Arizona. And it's my pleasure to have this discussion today with Dr. Che Martin. Just to give you a brief recap of who we are, I am one of the physicians and one of the chairs of the Doctors for Healthcare Business. I am actually chair of medicine, and we want to make sure that you guys know exactly where things. You can look us up on the Global Summit's Facebook page, as well as those of you who are interested in the top 100 doctor nomination. It's been very good. I mean, we've had a ton of positive feedback about it. If you look at the QR code above my shoulder on this side here, you can scan that to get your nominations in, those docs, who are doing great things, or even yourself, you can throw your name into the hat. We're happy to get all these nominations in. Now, today, what we're going to be doing is we have Dr. Che Martin here, who is the founder and CEO of Adele Reproductive Health Foundation and a higher clinical training institute in Cameroon. He is an independent senior family health clinician in private practice, sexual and reproductive health, and frontline public health for the past 5+ years. He is speaking out to the Ministry of Public Health and Cameroon Medical Council to give official recognition to health. On family planning and health programs in Cameroon and globally has helped adolescent girls delay motherhood. Adolescent health and well-being is a key target in the SDGs. Dr. Che Martin holds a certificate diploma in sexual and reproductive health and research from Geneva Foundation for Medical and Research, class of 2014. He's a member of Care Task Force, Health Initiative, Harvard School of Public Health, University of Oxford's Maternal and Perinatal Health Institute, and the Geneva Foundation for Medical Education and Research. He completed authentication and notarization for a doctorate degree in clinical science with the United States Department of State. That was in 2015. His work has taken him to more than 10 countries where he served in a variety of roles and spent the bulk of his career as clinician and trainer, coach, mentor, and entrepreneur and philanthropist, and future of work leader, fellow, and award winner in 2020. He worked as interim provincial coordinator for Cameroon Association for Family Welfare, where he coordinated community-based programs in 2 country offices. He volunteered supervisor for the President's Emergency Program for AIDS relief in 2012 to 2016. He is president for the Commission for the Development, Environment, and Health in the Mambanda local government area. That's to date. The HIV country representative, member of Women's Global Network for Reproductive Rights, member of the International Federation of Medical Students Association, Collaboration Network, and partner to the Stop TB Partnership and Cameroon TB Group. Dr. Che Martin is the focal person for Africa Global Day of Action for access to safe and legal abortion campaign in Cameroon. He's a bridge builder for the Ento Religious Mediation, USA and Quality in Business Certification by International Trade Council of 2019. A lot of accolades, Dr. Che Martin. It's a pleasure to have you here with me today, joining me all the way from Cameroon. Welcome. I am in Tucson. What time is it there in Cameroon right now?
Right now it's 14 minutes past 3, 3:14.
Wow. Okay, so for me it's 7:14. So we are on opposite ends. you would say you're in the afternoon. I'm just starting my morning. So, Dr. Che Martin, I do want you to start off. Just give us a brief intro. I know I said a bunch of your accolades, but tell me a little bit more about yourself and your family, and then you can go ahead and we can start this discussion.
Okay, thank you very much. It's an honor, a privilege for me to have this talk with the top 100 Doctor to Doctor P. Ponduna, scheduled GIS 2021. When it concerns my family, I'm a father of 4 children, 3 girls, one boy. And then the boy too is behaving like a girl too because there are three girls. So when they are plating their head, he will want that his own head should be plated also. When they are painting their nails, she will also want that his own nails should be painted. So he's more or less a man in gender, but a woman in physical and action. So I'm a father of four children.
That's
I have
opposite
worked
to you.
I've worked for 25 years, served in various forums, served in many organizations, government and private structures, international organizations, but now I am on retirement because I'm above 60. And that is why I now decided to create an NGO. An NGO that is Adair Reproductive Health Foundation. And one of the flagship of Adair Reproductive Health Foundation is the Higher Clinical Training Institute in Cameroon. It is the first and the only clinical training institute in Cameroon that is registered and affiliated to Kitmons University in the international in the US, Kitmons International University in the US, and also the nextgeneration.org in Canada. That's we are affiliated there. And as far as the International Trade Council, the Health for All in United Kingdom, they have linked us to more than 127 countries around the globe that we can train and send our interns either to clinics, to communities, to hospitals, and to health centers around the world. So today, I am here to present on the topic family planning. Why family planning? Most people think that they know information about family planning. Even those who are trained, like family planning providers, doctors, volunteers, and health professionals, they think that they know much about family planning, but whereas there is a lot of misinformation as far as that is concerned. That is the more reason why I'm trying to always promote this family planning situation for more than 25 years today. And I've also created the clinical training center where children can also be trained. We need to build future health, family planning healthcare providers who can help the communities, help the government, help the country, and why not help the world? So I'll give a brief definition of family planning, which is in the context of family planning help prevent, especially women and their families, not to have a pregnancy that they have not planned, an unplanned pregnancy, a pregnancy that is unwanted, and a pregnancy that is unintended. Now, when you have such pregnancies, you will be stressed up, and that will also affect the health of the mother as well as the health of the child too. Why not the entire family? Family planning also help to prevent the spread of sexually transmitted diseases and also sexually transmitted infections. Family planning also help to reduce the rate of infertility among couples, among youth, among people. That is my own way of defining family planning. Now, when we want to look at how can family planning help people around the world or in your community and society where you belong, you see that family planning will help protect women and their families not to have close children together. When these children are too close to one another, say 1 year, 6 months, 2 years, it becomes difficult for them to have good health. And they all, it will be difficult for them to transition to adulthood. So, family planning also protects women from being harmed Because when women give repeated birth, close birth, 6 months, 1 year, 2 years, not spacing 3 years, not spacing 5 years, it harmed them in a way that they become mothers too often because they deliver so often. It harms them to become mothers too young because you find a girl of 14 years, we have in records girls of 9 years who have given birth because of poverty, and that makes the mother too young. It also helps them have become mothers too old because when you are also uh, so close to your menopause area and you have a pregnancy, there is a high risk. That one is a high risk pregnancy because you can die during delivery, or you can be operated upon, or you can give birth to a premature child. And those are things that affects the whole community and why not the whole family. Now, family planning also helps to plan for the number of children that you want to have based on your resources. Because if you don't have enough money and you have 10, 20 children, it will be difficult for you to clothe the children, to educate the children, to give them good health, good education, and so on. Family planning also help people to choose their options. Yes. You choose your option where you will not spend money. That is a natural method. You choose options where you can spend money, which is an artificial method. And you choose options whether you should adopt a child. Because adopting a child too is money. If you want to go to adopt a child, there's social welfare involved, the ministry, so many organizations are involved, human rights organizations are involved, and all of that stuff. So it helps you to choose your option, whether you should give birth to 2 children, give birth to 20 children, take an artificial family method, or to adopt a child. All depends on your choice. So what is really new about this family planning that we are talking about now? I'm sure that when Dr. Gerard launched this program on the unpassive top doctors, many people must have been asking questions, what is really important and new about family planning? There's a lot more that we need to understand about family planning than what we already believe that we know. Family planning services have been disrupted. There's a lot of service disruption during this COVID-19 pandemic that has affected clinics, affected the world, affected families, affected individuals. Like here in Cameroon, it is difficult again. The rate of family planning users has dropped because they are afraid that when they come to clinics, they will be dictated COVID alert. And so there's a drop. There's also a lot of misinformation about family planning, either to the users, either to the health professionals too. Because if they are not well trained, because they have been no school actually where they train only family planning providers. We have nursing schools in Cameroon, government nursing schools, private nursing schools, international nursing schools, but I have never seen or had a situation where there is purely a training institution or a school for family health providers, like what I've created. So there is also this issue of S curve in family planning that we need to know about now, because reviewers and international researchers have developed an S curve shape to illustrate family planning growth, illustrate family planning rate, to illustrate family planning marketing strategies. All of this shows that At one end, there is a low growth. At the other end, there is a high growth. And in between, there's a potential rapid growth. So if the various governments of countries understand this aspect of the S-shaped curve, they'll be able to manage their resources in a way that they will improve their national family planning programs to meet up with standards of family planning goals. We have to also understand that within the context of family planning, there is a link between human rights, gender equality, and empowerment. And so family planning is a human right that belongs to all of us. And so nobody should restrict one person or the other from having planning as far as the family is concerned. I also think that family planning that people should know has a great impact on maternal, newborn, child, and adolescent health. Because if you do not understand all of these gymnastics in family planning, as I've said, when you go for prenatal consultation, your first clinics, they will tell you exactly what you have to do. They will tell you exactly what you should plan to have in your family. Now, the family planning helps also to shape the economic development of every country, the political situation of every country, and the future of these things are linked up to the Sustainable Development Goals. The Sustainable Development Goals that cuts across sectoral interventions that can hasten progress across 5 Ps. We say 5 Ps. And these 5 Ps are prosperity, people, planet, partnership, and peace. To illustrate a little bit on this, when you plan well your family, people will be happy, they'll be healthy, they'll be rich, and there will be no fighting. But like here in Cameroon and other African countries, people might choose to have 100 children, choose to have 20 children, just because they believe that since wealth is unevenly distributed to these low income and middle countries, they think that the children have to be their capital to lead the fathers, especially the men, to have chieftaincy titles in their communities. They also use this number of children as a war block to fight for them. Because if you have 2 children and you go to fight a family that has 20 children, you know that you have declared war to a bigger family. Now, if you have the planet, because resources are also planned according to what we have, some people will choose not to deliver so young because they want to work and accumulate enough income that they will take care of these children. They also want to have a smaller family that they should educate better so that they can also have employment or jobs opportunities. Planning our families also need partnerships because we need to work with one another. So if somebody in US, like where Dr. Jeda is, and I'm in Cameroon here, and I want to make a partnership there, it does not mean that it is only because of lack of resources, lack of the strength, lack of the knowledge, or lack of the skill. It is because we need one another. You have prosperity. When you plan your family well, you live a happy life because you are always prosperous. You send the children to good schools. Unfortunately, I came from a very poor background. And it is because I'm a scholarship product and all these connections, universities, schools, countries that I have visited is through scholarships. When you also have, you plan your family very well, the family is at peace. Yes. You are not stressed. You have a sound sleep. Because if they send a child because of school fees in the nursery, send another one because of school fees in the primary, send another one because of school fees in the high school, and then in the university, surely you'll be stressed up. And that is going to affect your health, which will enable you not to meet up with the family that you have created. Now, there is also information about training, as I said earlier. There are no schools meant to build up future family health providers, and which we really need to have those schools to upskill these providers to help couples control their fertility rate, to educate couples who are asking for partner, that's particular sex and twins. Because some couples come to the hospital only to say, Doctor, can I have a family plan that will make me have only boy children because I've now had only girls, and I don't have a successor? Doctor, can I have a family plan that will give me room to give birth to a twins because I like being called Tani or Mani? So all of that stuff. If we also have these schools that train providers very well, they will, they themselves, they lack the interest to train like providers. Because in the setup, the training setup in Cameroon, for example, I'm using only my country, people are, interested in training as nurses, as midwives, lab technicians, pharmacology, and all of that. But the family planning aspect of it is ignored. But forgetting to know that family planning is key, and reproductive health too is key. Because if you don't know how somebody is reproduced, you don't know how an embryo is formed to a fetus, to a baby, to a child, you will not know how to treat as a generalist, you will not know how to operate as a surgeon, you will not know how to take care of the teeth of the person as an ophthalmologist. When we also have these training institutions that will capacitate these family health providers, they will help couples prevent transmission of sexually transmitted diseases. Because these are the things that lead to infertility. They will also educate these people not to abort crudely. Because these are the things that also damage their wombs, and they cannot produce again in the later part of their lives. We have to train these people so that they can also correct misinformation. There's a lot of misinformation about family planning methods, especially the artificial methods. They will say combine oral contraceptives or progestin only contraceptive gives cancer of the breast. Intrauterine device, IUD, gives cancer of the uterus, which is not true. It's misinformation. They will also help people identify their needs in family planning, because when some of these users come to the hospital, they come without the knowledge of what it takes and what it is. And it is the providers that will give them the directives and guide them how to identify the exact method that they want or need. They will also help educate better those who supply these family planning methods, those who sell them. Because in the pharmacies, family planning methods are hardly there. Now I'm talking in the case of Cameroon. You only go to the family planning centers, which are mostly the government family planning centers that people have trust. And whereas in the community, these providers have a need to educate these people who supply these various methods and who sell them. We also have to train providers so that they, the private sector, we have to make them to understand that there is privacy in family planning provision. There is confidentiality in private family provision. Because if they don't know all about this, all of those things that they are doing will be exposed, and users are afraid that when they come to the clinic, it means therefore that they are exposed. Oh, I'm using this method, an IUD. Oh, I'm using the emergency contraceptive. Oh, I'm using, and then, oh, I'm using a condom. You come and buy a condom, they start pointing you with the finger that, oh, so you have sex today, and that's why you are preparing to get that condom. Those are certain situations that they have to guide against. They have also to train them. These main methods of classification in the family planning, because they are the barrier methods, which you have like the condoms, the cervical caps. The condoms are both for men and women, the cervical caps, and the spermicides. And you also have the natural methods, which people who do not even have money can also be educated to use these natural family planning methods, which are the rhyme and billing methods, which are the cervical mucus, which are the periodic abstinence, that's fertility awareness method, which are the use of breastfeeding methods, because the breastfeeding method is a natural family planning method that women themselves do not even know. You need to train providers who will be able to guide them to meet up with the criteria of breastfeeding method as a natural family planning method, because when you are using that as a method of family planning, that you should not have another pregnancy when the child has not attended 3 years or 5 years, then the first thing is you must be in the category of women that when you deliver, your menses should not come back before 6 months. You also have to belong to that category of women that feed the child exclusively with breast milk, without adulterating it, without mixing it with other food or water before 6 months. Now, the artificial methods are also there. You can use an intrauterine device, which is inserted in the uterus that prevents pregnancy from occurring. And you also have the hormonal methods that affects ovulation and the uterus. And of course, the cervical methods that prevent eggs from reaching the uterus for men, and also the tubal ligation for women that makes them not to have children again. If you think that you have already have enough children. Now, I want to conclude this talk here by saying that family planning information and services are fundamental to the health and right of all individuals, whether men, whether women, whether youth, whether adolescents, or whatsoever. A rapid scale up of family planning methods by various governments and funders will reduce unmet needs for users. Many people still see family planning, especially here in Cameroon, as a taboo topic. And so parents, especially women, find it difficult to put their boy child, to put the girl child, and talk to them about these methods of family planning. Because in their mind, they'll say, oh, if I'm telling this child, if you sex today, before 3 days, take an emergency contraceptive that will disrupt the pregnancy. It means that the children will say, oh, so my mother was doing this. And it will be a big problem. They hardly discuss this with their children. And so parents do not see the importance to talk about family planning with their immediate children, especially the girl child, because when the girl child gets pregnant at a tender age, education is disrupted. I mean, stress come in, and there are lots of problems that really comes in as far as that is concerned. And in Cameroon, men should see family planning as they see family planning as an issue of a woman only. They say they are not involved, which is a total ignorance. This is total ignorance. And so this is what I can say, and I thank you very much for listening to my topic.
Dr. Martin, thank you very much for your presentation on family planning, which I think is it's huge that we need to get this conversation out now and have people understand, you know, why it should be something, especially in families or for everyone actually on the forefront of their mind. And you made some pretty cool points, and I wanted to just kind of ask a few questions if you don't mind, and you and I can kind of go back and forth. So, with regards to COVID-19, so we're still kind of dealing with this public health pandemic crisis, which for a lot of countries is kind of winding down. What have you noticed in Cameroon? Because here's my speculation. What I've seen or what I've noticed is basically everyone's been stuck at home for a year. Being stuck at home for a year of 2020, you there's not much to do. You can't go anywhere. So partners, husbands, wives, girlfriends, I'm sure they would engage in some form of intimacy or sexual relations. So what have you noticed or experienced in Cameroon actually, or in your look with regards to birth rates or pregnancy rates post 2020 year? What do you anticipate and what have you seen so far?
Yeah, thank you for that question. Actually, the year 2020, tell me the bad year, because we had government lockdown completely. We were affected completely, including myself. My school was closed because all schools were closed from March till September 2021. That's from March 2020 to September 2020, actually. So for us to re-strategize and get back to open these structures, we have to use a lot of strategy, and we're going slowly because even still then, the government is still monitoring, and that COVID is very much present, and that people should not be crowded in a place more than 50. Even the clinics, as I told you earlier, users of family planning methods have reduced. They are even afraid that when they come to the clinics with little fever of 37.5 degrees Celsius, we will declare them COVID alert. And so they manage the situations back in their very homes. And let me also make it very clear here. This period of 2019, 2020, this COVID has impacted all families, all organizations, all structures, individuals, to the extent that, coupled with some other crises that we have in the Anglophone regions of Cameroon, the Southwest and Northwest, and there's an influx into the economic and political capital in Douala, youngsters are getting pregnant on a daily basis because they don't have food. to put on their table. The girls go on prostitution and they're getting pregnant because they are not educated on how to use this family planning method to prevent this unwanted pregnancy or unintended pregnancies. And the boys too, they have resort to kidnapping, stealing, waylaying people, armed robbery, pickpocketing, and those are the kind of difficulties that we're really facing. So that's what I can say about that.
Yeah, so obviously 2020, lower socioeconomic status, everyone's on lockdown. Even if you're not low socioeconomic status, the fact that everyone was forced to stay home, you made the point. They couldn't get access to the actual, methods of contraception. So we are going to see an increase in the birth rate, and you've already been seeing some of that, especially the fact that you just pointed about young women having to resort to prostitution or sex working in order to get some level of in. And of course, that's not a safe way to make a living, especially with regards to STDs, other STIs, and of course the pregnancy, which can happen with that situation. Okay. Now, with regards to the children, because I firmly believe that we have to educate. I mean, what you're doing with the health providers and teaching them to be able to teach others about the different methods of family planning which are out there is important. But in order to change generational mindset, we should start with the school age children, obviously, and put programs in place. So what's going on? What do you think, or what's your dream in terms of something potentially in the schools, and how young would you recommend starting teaching kids
Yes.
about family planning? And of course, it's going to be, I think it should be something big. So if you're just understanding what a family is in terms of mother, father, however you want to describe it, and the importance of having different things in the home. What's your take on that?
Yeah, Dr. Joda, to be very honest with you, it's a huge area that I've been reflecting about. And since I have this higher clinical training institute in Cameroon, my focus and goal was to help train as many healthcare providers as possible so that they can help both the families, both themselves, both the government, and the country at large. Now, I just developed another innovation because with this COVID presence, and which has come to stay because COVID will not go away again.
I agree.
Yes. So I've designed another program, psychosocial agents training. This psychosocial agents is a new course that I've introduced in my institution and which has a curriculum to train people who can counsel parents, children, adolescent, youth on mental health issues because this COVID has really brought in a lot of trouble. People, you find the BPs, blood pressure is increasing on daily basis. I mean, people are getting into difficulties of strokes. And that is exactly what we're doing because if we don't get these people trained to help educate this population, do them counseling, do sensitization, make outreach programs, even to communities, because when you stay in the clinic and wait them, they will not come. You need to reach them out there in their communities, mount campaigns, talk about COVID, talk about methods of family planning. But the unfortunate thing with these institutions, like what I have, is lacking because the structures are dilapidating, the structures are old, there are no training kits. We only use theory. We don't have these mannequins. What do you have? Mannequins, artificial mannequins, to illustrate how to put an IUD in a woman's uterus.
Mm-hmm.
We don't have artificial penis, how to wear a condom,
Mhm.
and so all of those things. We need them. But again, too, I don't very much blame anybody. I also blame our geographical placing. Mhm. Cameroon is one of those difficult countries where you can hardly have any good thing because the government authorizes your NGO, give you an authorization with the left hand and take back in the right hand, making sure that you should not have fundings, should not ask solicit fundings from anywhere. When fundings are coming from anywhere, they will tell you what this money is coming for where and for what.
Mm.
Even there's no explanation. Even if you explain, I think you can just explain to deaf ears. So unfortunately,
Yeah, so
things.
bureaucracy is always a problem. Government bureaucracy is always a problem, and especially for programs like this, because that would be my next question to you. Like what needs to be done on a governmental level to be able to do this? Because let's face it, the stress on a country or on the infrastructure is there as you increase as the birth rate goes up, because the more mouths you have to feed, the especially with limited resources based on where you are, the more difficult it gets. Let's just say, I mean, governments come and go. you know i
That's
i
true.
i,
Yeah.
I think we just have to try to start at the grassroots level, on the ground floor, with
Mhm.
with the people who can make the change. um Speaking of change, let's talk about, you mentioned something which is interesting to me, with regards to the size of a family and how it is viewed, in cultural areas. Also, where if I have two kids but you have six, you're viewed more as a in a chieftain status. Like, okay, you're more of a you're viewed more successfully in certain communities because you have X number of children. So now that is cultural. So how do we get that to change? Because that's a huge driver as well. Because when a child is in what I'm thinking is, if a child is born into a family and the child has six siblings, and they see how, especially a boy, and he sees how, okay, dad had six kids, I have to have six kids too, or I have to have this even more than dad, because when dad had this much, in the community, was seen as the man. He was seen as, a successful guy, even though
Mhm.
we were technically living in some level of poverty, but they don't see it that way. What they see is, everyone, respected dad because, he had six of us. So how do we get that cultural mindset to change? Because I mean, if that is something we can do, I think we can make huge strides forward with regards to family planning, and honestly getting people to realize that, hey, you know what, I really need to think. If I have six kids, how am I going to feed, keep healthy, protect, these six human beings that I'm in charge of?
Yes, Dr. Gerard, that is a very interesting area, and that's the area we are more focused because I'm using myself as an example when I'm teaching, when I'm mentoring, when I'm coaching, when I'm sensitizing. I'm alone to my father. And you can imagine that in an African family, alone to my father. I don't have a sister, don't have a brother. But my mother had to go deliver other children, my stepsisters in other homes, because they believe in the number of children. That is good to deliver many children so that God should take the ones he wants to take and leave the ones he wants to leave. Why do you even deliver a child and decree that one to death? It's not possible. Now, I want to think that is very easy, but the way to do it is difficult because the means, the resources, the mobilization resources are not there. If you look at how people are moving from Bamenda, from Southwest now into capital city, into the political and to other regions the ate French reason. They now begin to understand that it's difficult. Because even the children that they have, because they want to boast of, oh, I want to own a chieftaincy title, oh, I want to have a war block that they can fight, they now realize that things have come to change. They have killed the children, and they don't have again. And so the young ones, we can educate them, and they will listen more carefully. It's just continuing education,
Mhm.
continuing mobilization, continuing campaigning, continuing talking frequently. Because when you go and give a gap for too long, the whole thing goes off
Mhm.
because there are other things that will come. But if you are constantly there to talk, say in a month you are there, next month you are there to talk, the people will begin to understand that there is something wrong, that there is really something critically wrong, and that they have to reduce the number of children. Actually, we are doing it, and there's some are understanding. But some difficult families that will say, oh, they deliver my father alone. I want to now make my sisters, make my auntie, make my this. That woman too is in danger because I say when you become a mother repeatedly, repeatedly, frequently, frequently, you harm your own life. And obviously, you will die and leave the children, meaning therefore that you are working in vain. So you have to give the number of children that your resource permit, that you can take care, especially now that this COVID has come and impacted every place, and with all other difficulties, conflict and crisis, people have to reason. People have to understand. We're operating in Southwest and in Northwest and in Douala because our headquarters is in Douala. But then we had closed the center in Mordecai in Southwest. We have closed the center in Bafut in Northwest, and we are only concentrating here in Douala, which makes it difficult for us. But things are getting to normality, and I
Mhm.
think we can start back because I'm planning again to see how I can go back to Northwest and start back putting the structures together because all along I've been working with his parent publisher guide in the US, the Vitamin Angels in the US, who have been sending me multivitamins for pregnant mothers, who have been sending me vitamin A 100 and 2000 international units for children. And that's how I was distributing it in South, distributing it to help the poor local communities in Bafut where I come from. But now it's difficult. But I think we can start back gradually. We can go gradually. And definitely God will help us.
Agreed. Agreed. So, with access to birth control, I know you had mentioned that people couldn't get out of their houses to do that. Now, does your NGO provide that as well, like access to condoms, the cervical caps? Do you or the spermicides? Is there capacity to be able
Yes,
to provide those? Now, when I say provide, I actually mean if it's for free. Like, okay, you know what, you do the training, we give you 10 or whatever it is.
yes,
How has that been going? Or do you guys do that?
yes. That has been very possible because I think from my view, you understand that I work with Cameroon National Association for Family Welfare.
Hmm.
And the Cameroon National Association for Family Welfare, CAMNA4, was a project of the International Planned Parenthood Federation in London. They have condoms for women, cervical caps, condoms for men, spermicides. And since I worked with them for 5 years and my contract got finished, what I'm just doing now in Douala and the local communities that I'm attached to, I'm doing a replica of what Kamnafor is doing at the central level. And so even though they are not frequent supplies of these methods, but when they have, I get some from them
Hmm.
that I use to teach. I use to give out freely so that people can test because you should not only train and they don't test. I use it for illustration in class during my lectures. And I had formerly worked with GTZ. GTZ that has changed now into GIZ. I worked with GIZ for more than 7 years. And they were giving me these condoms, and I was in charge of promoting the condoms in the enclaved areas, in their division, in Southwest, in Northwest. I used to carry a television and films, the orphan generation that they used to give me, and I go to those villages, linked up with the chiefs, the various
Mhm.
chiefs of those areas, because we have a strategy to enter a community. We come to the chief, and the chief organizes and make announcement for the community to understand that there is something coming. So he assembles them either in a community hall, in a church, in a development hall, and so on, in a school, in a space, a field, where we set up those films, the people watch, we see how HIV/AIDS patients are suffering, and then later on we give our lectures and distribute those materials free of charge to them. But now it's a little bit difficult because the continuous chain supply is not available, but I'm still hopeful that things will change. And when things change, we will still get linked up and we'll still get connected so that we can continue to move ahead.
Thank you so much, Dr. Martin. It has been a pleasure talking to you today about family planning and all the great strides you're making and fighting for in your home country of Cameroon. The family planning conversation is one that it should be global. And a big point you made was with the whole pandemic. I think the pandemic has opened our eyes to a lot of inefficiencies that we have, or insufficiency that we have in a lot of areas in whether it be healthcare and in general life. So people need to definitely take heed, because if you're a student of health and science, you know that the next pandemic is around the corner. We don't know
That's
when,
correct.
but
Yeah.
it is around the corner. I mean, with globalization and the world becoming an even smaller and smaller place because we can travel, we can see more and more of these types of pandemics cropping up again, and life being shifted way to the left or way to the right because of that. So planning is key for those things, and whether it means honestly family planning, I think that should be a huge part of it, because going through the loss of a loved one or a child or someone in your family because of a pandemic is a rough thing to deal with. So being able to plan and say, okay, good, we're gonna keep it, where we have a smaller unit where we can manage, keep healthy. Because I mean, you and I both know as physicians that a lot of other factors, health factors, it will impact your response to virus infections, especially with COVID-19, whether it be diabetes, high cholesterol, high blood pressure. If those things are left untreated or improperly managed because of lack of resources, just imagine what it would be like if you get COVID-19 and you have those diseases untreated and not managed properly. It can get pretty disastrous, and I've seen it firsthand in some of my own clients and patients in the US. um, so Dr. Martin, before I wrap up, any closing remarks you want to give to the public watching? um,
Sorry, I didn't get you clearly.
I say, any closing remarks you want to say to the public watching, like your website or anything you want to put out there?
Yes, the unfortunately I don't have a website
Okay.
because we deal with Ponzi business people in Cameroon. Ponzi business. I managed and paid some money for a website to be
Hmm.
developed for me. It was actually developed and it lasted just for 1 year because I discovered that it was not working well.
Okay.
They set it up just like a clock to be ticking, and producing no results or impact. And I consulted another person who said, okay, the first person has done it wrongly, so I should pay some other money so that he can get
Hmm.
on to correct it. Actually, the second person did some work, but the first person decided to hold the password to the background office that we have to be updating our website. And
Wow.
he's insisting that he is the only one to be updating it, and that is on a fee. And since COVID came, he said we should give money again, and that money is not within reach, so that he can pay back, renew the hosting space,
Oh,
which,
okay.
which to me, I do not really understand, because when we started earlier, I told you I'm not so good in social media handles and all of these things.
No, of course, of course. I get it.
Yeah, so it was above me, and they shut down the website.
Mm.
Um,
So,
hopefully,
so how can
we
we? How can you get contacted? Is by email? How can you get contacted?
to the guy.
If somebody wanted to contact you personally to get more information,
I will give
what's your contact?
I will give my email.
Yes.
Gwewasang, that's Gwewasang at
Hmm.
Gwewasang, as you know,
Yeah.
at gmail.com,
Uh-huh. Okay.
or the Go Founders Gmail, which is Gwewasang C Martin at gmail.com, or the
I'm putting mhm.
Adele Reproductive Health Foundation web email, which is Adele_at yahoo.com.
So on Adele underscore at
Adele
yahoo.com. Mm-hmm.
Adele underscore health center, Adele underscore health center at
Okay.
yahoo.com. But I can send you the information. If you send me,
Yes.
I will send those information to you. But what I'm
Yeah.
doing now actually is that the doctors and hospitals, they have a block. They have a block where they are also helping me to advertise some of my programs.
Okay.
So I
Good.
can also send that link to you.
Good. So
Yeah.
yeah. So just send that to the moderator, and then we'll make sure we put it in the actual Facebook feed so people can be able to get. I did put in the chat the at least one of your emails, the gwewasang@gmail.com. So that way you can be contacted if with anyone who's interested in learning more or even potentially helping you with your programs.
Yeah.
Just as a reminder to everyone who's watching, the QR code above my shoulder there, it definitely will give you access to the top doc nomination. You can definitely go in, put someone's name in. Dr. Gwewasang, I encourage you to go into that as well for yourself to be able to nominate those that you know, or even yourself, for all the great things that you have done, because people will definitely vote on that. And of course, we had a pleasure. It was a pleasure talking to you today, learning more about what you're doing. And I do hope we can have future conversations. And who knows, maybe have one in the future where you're like, oh my God, Dr. Morris, everything opened up, everything came back. We're making huge strides because, I like to be a firm believer in education. I mean, if there's one thing people can't take away from you is what you learn.
That's
Whatever you
correct.
learn and you get to keep and you get to use and you get to mold into creating a future for yourself that I think can be really ideal if used
Yeah.
appropriately.
Good.
Um,
Okay.
Again, Dr. Gwewasang, I wish you a happy Father's Day coming up, and all the best to you and your family and your NGO as well. To those watching, I thank you, and don't forget you can get your CEU credits for taking part in our discussion and watching today. The link will follow, and will be on our Facebook page at Global Summits Facebook page. Thank you, everyone. Thank you, Dr. Gwewasang, Martin, and have a good evening.
Thank you, Dr. Gerard Miris. The honor is mine. And I think that today is my day. Today is my day, because I've added my voice to the International Doctors Program.
Yes, I agree.
And I wouldn't doubt it. It's going to go
I agree.
wild. It's going
I
to
agree.
open doors for opportunities. So I thank you very much. I thank the Go founders very much. I thank the Unpassive founder, Ash Mufara. I thank you people. I thank the community very well.
You are welcome, Doc,
Pleasure is
and same here.
Okay, thank you very
Take
much.
care. Bye-bye.
Take care. Bye.